Good morning, everyone. So today I have a tummy tuck with a pubic lift on a young mom of 2 who post-pregnancy has loosening of her abdominal wall, abdominal muscle separation, as well as loose skin of her abdomen and her mons. So the surgery today is going to repair her abdominal wall muscles and tighten her abdominal wall, and also remove and tighten excess skin of her abdomen and her mons. So I've elevated all the tissues off her abdominal wall, and you can see the edges of her muscle that are separated. And I've marked that with a marking pen. You can see at its widest point it measures almost 5 centimeters. So this is going to really help strengthen her core and make a huge difference for her. I'm doing the muscle repair, taking perfect, even bites. And you can see the actual edge of the muscle here coming together, and I do it as precisely as possible so the patient ends up anatomic, so that way when she exercises, the muscles will pull evenly. See how nice that looks? There's no weird bunching underneath. And some people, when they do the tummy tucks, they use interrupted figure of 8s, meaning they just put a few interrupted sutures along the muscle, but I think that makes it bunch really unevenly instead of it being just a really nice seamless repair. It's like kind of like taking little bunches all along it, and I think patients feel that irregularity. After placing the first layer, I've actually wrapped it with a second layer, so beautiful even 2-layer muscle repair all the way from the top of the ribs all the way down to the pubic bone, so that way there's no gaps and the patient doesn't feel a bulge at the top or the bottom. Now I'm placing long-acting numbing medicine underneath the repair so my patient will have little to no pain, and most of my patients need no prescription pain medication. They just take a few Tylenol right after surgery. She'll be walking tonight. So with the gentle tummy tuck technique, my patients have a really quick recovery. And now I'm performing the pubic lift in order to stretch and lift the mons pubis, so that way the whole area will be evenly and uniformly tightened. See how that lifts it? Okay, so now I'm going to measure and weigh the flap. The flap measures about 11 inches, which is equivalent to 28 centimeters. The cushion is only 4'11", so this is a really large piece of skin and fat coming off her. And you can see here, there's pubic hair here. This is the crease that was above her pubic area, so I've taken some of the skin from the mons in order to pull up and stretch it. This up here was her old belly button, so I've been able to get all the skin from on top of her belly button out. And then you can see all these extensive stretch marks that I have removed. I just wanted to show the layers of the flap. So here's skin. Dermis is the white layer right underneath the skin. This is the superficial fat. A layer of fascia that separates it from the deep fat. You can see all those layers here in the flap. Okay, and the flap weighs 2 pounds and 13 ounces, so almost 3 pounds. Equivalent to 1.28 kilograms. Now I'm just getting hemostasis, meaning making sure nothing's bleeding. And you can see she's had little to no bleeding in the entire surgery. I'm just being really meticulous and gentle. So I've delineated the lateral edge of her ab muscles, and now I'm placing tacking sutures to secure the flap down and also create the appearance of abs. Completing the closure on this side, and I've closed in multiple layers, about 7 layers, from deep to superficial to get this perfectly lined up. And you can see, even though she has a lot of stretch marks, I've been able to close it so there's no bunching. And I'll also show the closure on the other side, but look how beautiful, thin, and perfect the incision line is. Taking really small and perfect bites. other side, and I'm closing in layers from deep to superficial. You can see me taking a nice bite from this deep fascia, securing it to the other side nicely. See how that brings it together with a lot of strength. It's really important to close in layers. Basically, I'm going to line up this entire top flap with the entire lower flap in multiple layers, so that way it comes together perfectly. Otherwise, if you don't do that, you'll get a step off. So if you see other tummy tucks and you see a chunk of fat, a big wide sunken in scar, another chunk on the bottom, it's because it wasn't closed in layers. Closing this side, and you can see just how perfectly that's coming together. This is a deep dermal stitch, which is a layer just underneath the skin. So when I do the subcuticular layer, it will be super, super thin line, and it's just important to make this look as perfect as possible. Just putting the finishing touches on the belly button. Look how natural and cute it looks. You can see a little dimple in the middle. All the incision line is dunked in, so you'll never see the scar. There's a little depression on top of it, and now I'm placing these special sutures so nothing crosses and you won't see any train tracking. Okay, so I just want to show how beautiful the final result is. Beautiful, flat, contoured abdomen. Looks amazing. We'll show the 3/4 view. Sorry, before I do that, I want to compare with the before. You can see what a huge difference this has made. Okay, in 3/4 view, you can see beautiful, smooth, contoured abdomen. Huge difference from the before. It looks amazing.